everybody. My name is Zara Hamilani, and my job before I got asthma was to be a corporate lawyer and to speak all day in front of the courts. It was August 2019, and I'd never really gone to the doctor. I wasn't really sick. I was 47 years old. I'm an active mom of 3 kids, and I never really took time to do anything. And all of a sudden, I got so sick that I just couldn't get out of bed. And everyone said, you have COVID. And you remember that time when nobody really knew what that meant. You would actually go to the doctor and say, oh, take a COVID test. It was negative. It was negative for weeks and weeks. Later on, the antigen test told me I was positive at some point. But it was at that time that I started to realize that, you know what, I need to take my health seriously because it became a trickle effect for so many other things. I would eat certain foods and I'd break out in hives. I would go outside, I ride horses, I do boxing. Couldn't do those things. I'd go to the polo field, we live on the polo field, and I would actually turn red as a tomato. So my quality of life really, really changed. And I started to say, okay, what do I need to do? I was on Clarinase and Allegra and Zyrtec and all sorts of over-the-counter stuff. And then finally, I actually decided that I was going to seek professional consultation beyond just taking antibiotics and that. And I started at King's College Hospital seeing a doctor named Dr. Asif Sattar. And he started putting me on Foster and the blue asthma medication and the red asthma medication, and I started doing it. But I was one of those patients who I got a little bit better and I stopped doing it because I thought, oh, I'm traveling. When I'm in New York, I'm fine. When I'm in London, I'm fine. It's only when I would get home that I'd start to feel sick again. So I was one of those patients that actually said, okay, I'm fine, I'm okay. And then I came and I met Dr. Syed Husain, who one day sat me in his clinic and spoke to me for probably a good 40 minutes, giving me a lecture, much longer than I should have been there, and telling me how important it was for me to actually breathe in and use that sort of glass container to actually take the asthma medication all the way into my lungs. It was the first time somebody had actually explained to me that this is what I needed to do to ensure that I start feeling better. And I can tell you, it's now been about 3 years. I started getting on Fasenra probably about 14 months ago, and that's changed my life. I mean, I had phlegm every single morning. I was constantly sick, and I would say after just maybe 2 treatments of that to 3 treatments of that, I started to feel so much better. So one of the things that I actually do now is I'm back on my horse, I'm able to go boxing, I'm back at work, and I'm doing different things, which has become a real change in my life, which is why when he asked me to come and speak, I wanted to share that it is important because sometimes as adults, we don't take the time to look into symptoms for the long term or make changes in our diet and make changes in our lifestyle. But I think with doing the combination of medication and those things, there really was a big transformation. And I'm pleased to say, I'm now 50 years old and I feel better than I ever felt before. So that's my story.
So tell me, are you injecting yourself at home or not?
I'm able to. So You've taught me how.
Yeah.
And the last time I came into the clinic, because I had to come back just to get the prescriptions redone, I did it in front of you by myself.
So this is the magical thing about this treatment, that people don't have to be in the hospital, though for cautions and for taking it very seriously, because these patients can have allergic reaction to this injection, so it can be very serious. So we make sure the first 2 or 3 times we delivered in under our supervision in the hospital, and also we make sure that the patient stays after this for 45 minutes to an hour. So we said that biologics do work very well, and you're having a normal life because of the biologic treatment, and you know how to inject it, though the first 2 or 3 doses we gave it into the hospital, made sure there was no allergic reaction, and then you went home. Professor Basim is going to enlighten a bit more about the biologics, but this is again a story of success that we have locally here, our patients benefiting from biologic treatment. So
the standard of care that you gave to make sure that you explain things to your patients, which sometimes is missing from a lot of doctors. So I appreciate that.
Yeah, well, this event is a part of that, to get more understanding from the patient. And I was just saying to Kimberly, our 20 minutes and 30 minutes in the clinic sometimes is not enough. But this is like a very important to empower our patients to having these tools to understand what the disease is like and what is there. Now, a lot of people on steroids, long-standing steroids, don't realize that they could get rid of the steroids. The steroids can be put down, the tablet steroids we talk. But the inhaler treatments and other things don't stop with biologics, but at least they could be without the steroid tablets. So it's a huge change in their life if they did not come to the right clinician and right clinic and the right hospital to have the right care. I'm very privileged to have all the services here at King's College Hospital, including spirometry, pheno, and the IG available. And usually it's a one-stop shop when people come in, so they don't have to come second time to have more tests done, including blood tests.